Okay, so today we're going to clean this nice lady's nose. She had a skin cancer repair yesterday. We're going to start here just with just have some hydrogen peroxide and a little medical cup with some Q-tips dipped in that hydrogen peroxide. So they're pretty soaked with hydrogen peroxide. That's a good way to get the dried blood off the skin. And we won't record every little step, but what I want to show people here with this video is that when you have that dry blood, it looks a little scary the day after surgery, but if you just make contact of the blood with the Q-tips soaked in hydrogen peroxide, you get that nice little fizzy, kind of bubbly reaction which almost liquefies that kind of dried, scabby material. So it's normal to wake up the day after surgery and see a lot of dried blood, and that's obviously can be, shall we say, emotionally distressing to a patient. But if we just really get in there and liquefy it with this hydrogen peroxide, you can see that just in the short time I'm doing this video here, that we've already liquefied about 80% of it. So all that's now more or less gone. And the thing is, when you use the peroxide, it's more gentle on the skin, a little bit left behind there, so again you get that nice little fizz reaction. Sometimes what you'll learn is when you first make contact with dried blood and the Q-tips that are soaked in hydrogen peroxide, that you get that nice little fizz, a little bubble, and that seems to be, to me, what really loosens the blood, is that little fizz reaction. So kind of if you run out of that little bubble reaction, it's time to get another couple Q-tips, because they seem to work best when they're just freshly wet. Go to that stuff and get it cleaned off. So again, in the 2 minutes of this video so far, you can see there was a lot of kind of scary looking, not so nice looking dry blood, and there you go, pristine. So you're a lot less scary looking than you think after any type of facial surgery that involves stitches. Now the last little thing we're going to do here is get the stitches along the, actually clean along the stitches themselves. So the difference between cleaning around the stitches themselves and just dry blood on the skin is that the stitches can be a little prickly, because suture material is kind of prickly, like fine fishing line or something that you'd have. So you just want to kind of you don't ever want to get the cotton of the Q-tip stuck in the little prickliness of the stitch. So just have a little gentle touch that, again, you let that fizz, that bubble reaction do most of the work for you. There's a little dry blood here. So I'm not going to rub out on it so hard with the Q-tip that I would get the Q-tip cotton stuck in the little twines of the suture. But again, I'm more about 80% of this is just the little fizz reaction of the hydrogen peroxide with the dry blood, and maybe 20% of this is just the mechanical cleaning with the Q-tip. But really let that fizz reaction kind of soften that blood for you. That's doing most of the work. Otherwise, again, the cotton can get a little stuck in those prickly stitches. Nothing bad will happen, but then you'll walk around for a week with little white cotton stuck to your blue stitches. And we'll get one more little area here, but I think that almost tells the story. Another example, just some dry blood there, always distressing, so they have to appreciate and I appreciate as a facial plastic surgeon, there's an emotional aspect to when you wake up with stitches anywhere on your face, and you see that kind of scary dry blood. But what this video is there, or we're making this video, is to tell people that are doing this from home that it's not nearly as bad as you think. And again, in just 4 or 5 minutes in your bathroom, you can get most of this stuff cleaned up. And it's just the nature of facial surgery that you're going to have that dried blood the next morning no matter what we do. The human face has a lot of good blood flow. That's why scars heal nicely on the face. But that good blood flow also means that you're going to have little drippiness from your stitches that first 24 hours. No matter how much we do to control that in surgery, there's always a little bit of weeping from the skin edges. But there you go. Nice and clean, and so far this video is only 5 minutes long. So basically what you've seen here is 2 steps. Step 1 is the cleaning with the Q-tip soaked in hydrogen peroxide. Step 2 is kind of dabbing things with the gauze to get the peroxide off the skin. Now step 3, we're just going to use some standard bacitracin antibiotic ointment. You can get this over the counter. We often give you little packets in the office. Either way, just take a little scoop. Maybe, I always say it's about the size of a little peanut or a little raisin. Just that much, not that much. And then just do a nice thin layer everywhere there's a stitch. And the nice thing about this also is if you get to a spot where there's a little dry blood that wouldn't quite break away with the cleaning, you don't have to go for it in the first session. You can just put a little ointment on it. And the ointment itself will soften maybe a little stubborn area. So when you go to clean it maybe in the middle of the day, if this is your morning cleaning, that this ointment being in contact with that stubborn area, it'll just be all the more softened and it'll really bubble away easy with the peroxide. So there you go. That's your 6-minute video for basic suture care. Thanks.